Hepatitis. Hepatitis is the term used to describe inflammation of the liver. It's usually the result of a viral infection or liver damage caused by drinking alcohol. There are several different types of hepatitis. Some types will pass without any serious problems. Others can be long-lasting, chronic, and cause scarring of the liver, cirrhosis, loss of liver function and, in some cases, liver cancer. Inflammation is a tissue's reaction to irritation or injury which generally results in swelling and can cause pain. There are many causes of hepatitis. Several viruses are known to cause hepatitis. Viral hepatitis can be spread from person to person. Some types of viral hepatitis can be spread through sexual contact. There are 5 known hepatitis viruses which are categorized by the letters A through E. Symptoms of hepatitis. Short-term, acute, hepatitis often has no noticeable symptoms, so you may not realize you have it. If symptoms do develop, they can include muscle and joint pain, a high temperature, feeling and being sick, feeling unusually tired all the time, a general sense of feeling unwell, loss of appetite, tummy pain, dark urine, pale, gray-colored poo, itchy skin, yellowing of the eyes and skin, jaundice. See your GP if you have any persistent or troublesome symptoms that you think could be caused by hepatitis. Long-term, chronic, hepatitis also may not have any obvious symptoms until the liver stops working properly, liver failure, and may only be picked up during blood tests. In the later stages it can cause jaundice, swelling in the legs, ankles and feet, confusion, and blood in your stools or vomit. Hepatitis A. Hepatitis A is caused by the hepatitis A virus. It's usually caught by consuming food and drink contaminated with the poo of an infected person, and is most common in countries where sanitation is poor. Hepatitis A usually passes within a few months, although it can occasionally be severe and even life-threatening. There's no specific treatment for it, other than to relieve symptoms like pain, nausea and itching. Vaccination against hepatitis A is recommended if you're at high risk of infection or severe consequences of infection. You're traveling to an area where the virus is common, such as the Indian subcontinent, Africa, Central and South America, the Far East and Eastern Europe. Hepatitis B. Hepatitis B is caused by the hepatitis B virus, which is spread in the blood of an infected person. It's a common infection worldwide and is usually spread from infected pregnant women to their babies, or from child-to-child contact. In rare cases, it can be spread through unprotected sex and injecting drugs. Most cases affect people who became infected while growing up in part of the world where the infection is more common, such as Southeast Asia and Sub-Saharan Africa. HBV. Most adults infected with hepatitis B are able to fight off the virus and fully recover from the infection within a couple of months. But most people infected as children develop a long-term infection. This is known as chronic hepatitis B, and can lead to cirrhosis and liver cancer. Antiviral medication can be used to treat it. Vaccination against hepatitis B is recommended for people in high-risk groups, such as healthcare workers, people who inject drugs, men who have sex with men, children born to mothers with hepatitis B, people traveling to parts of the world where the infection is more common. In 2017, the hepatitis B vaccine was added to the routine immunization program so all children can benefit from protection from this virus. Hepatitis C. Hepatitis C is caused by the hepatitis C virus and is the most common type of viral hepatitis in the UK. It's usually spread through blood-to-blood contact with an infected person. It is most commonly spread through sharing needles used to inject drugs. Poor healthcare practices and unsafe medical injections are the main way it's spread. Hepatitis C often causes no noticeable symptoms, or only flu-like symptoms, so many people are unaware they're infected. Around 1 in 4 people will fight off the infection and be free of the virus. In the remaining cases, it'll stay in the body for many years. This is known as chronic hepatitis C and can cause cirrhosis and liver failure. Chronic hepatitis C can be treated with very effective antiviral medications, but there's currently no vaccine available. Hepatitis D. Hepatitis D is caused by the hepatitis D virus. It only affects people who are already infected with hepatitis B, as it needs the hepatitis B virus to be able to survive in the body. Hepatitis D is usually spread through blood-to-blood contact or sexual contact. It's uncommon in the UK, but is more widespread in other parts of Europe, the Middle East, Africa, and South America. Long-term infection with hepatitis D and hepatitis B can increase your risk of developing serious problems, such as cirrhosis and liver cancer. There's no vaccine specifically for hepatitis D, but the hepatitis B vaccine can help protect you from it. Hepatitis E. Hepatitis E is caused by the hepatitis E virus. The number of cases in Europe has increased in recent years, and it's now the most common cause of short-term, acute, hepatitis in the UK. The virus has been mainly associated with the consumption of raw or undercooked pork meat or offal, but also with wild boar meat, venison and shellfish. Hepatitis E is generally a mild and short-term infection that does not require any treatment, but it can be serious in some people, such as those who have a weakened immune system. There's no vaccine for hepatitis E. When traveling to parts of the world with poor sanitation, where epidemic hepatitis E may be common, you can reduce your risk by practicing good food and water hygiene measures. Healthcare providers might not be able to identify the virus causing hepatitis as one of these. Other viruses. Other viruses, such as CMV, EBV, and HSV can also cause hepatitis. Most people recover from hepatitis, and the disease is often preventable. However, it is still considered a serious health risk because it can destroy liver tissue, spread easily from person to person, weaken the body's immune system, cause the liver to fail, cause liver cancer, cause death, in rare cases. Alcoholic hepatitis. Alcoholic hepatitis is a type of hepatitis caused by drinking excessive amounts of alcohol over many years. The condition is common and many people do not realize they have it. This is because it does not usually cause any symptoms, although it can cause sudden jaundice and liver failure in some people. Stopping drinking will usually allow your liver to recover, but there's a risk you could eventually develop cirrhosis, liver failure or liver cancer if you continue to drink alcohol excessively. You can reduce your risk of developing alcoholic hepatitis by controlling how much you drink. It's recommended that you do not regularly drink more than 14 units of alcohol a week. Autoimmune hepatitis. Autoimmune hepatitis is a rare cause of long-term hepatitis in which the immune system attacks and damages the liver. Eventually, the liver can become so damaged that it stops working properly. Treatment for autoimmune hepatitis involves very effective medicines that suppress the immune system and reduce inflammation. It's not clear what causes autoimmune hepatitis, and it's not known whether anything can be done to prevent it. How does someone get or spread hepatitis? Hepatitis can be spread through food or drinking water carrying the virus through bits of fecal matter from an infected person. This is called the fecal-oral route. You can also get hepatitis A from sexual contact. A person can get hepatitis B in many ways, including having sex with an infected person, sharing dirty needles, being in direct contact with infected blood, getting needle stick injuries, being transferred from mother to unborn child, being in contact with an infected person's body fluids. An infected mother has a high chance of giving hepatitis B to her child during or after birth. All pregnant women should be tested for hepatitis B. Within 12 hours of birth, infants born to mothers with hepatitis B need to receive treatment with hepatitis B antibody and hepatitis B vaccine. This can prevent transmission of hepatitis B from mother to the baby. A person can get hepatitis C from sharing dirty needles, being in direct contact with infected blood, getting needle stick injuries, having sex with an infected person, less common. Blood products are currently tested for hepatitis B and C, so it is not likely that a person will get hepatitis from receiving them. Blood transfusion. However, blood transfusions or organ transplants before 1992 might have not been tested for hepatitis, in particular, hepatitis C. If you received a procedure before 1992, you might want to get tested for hepatitis. Additionally, baby boomers, born in the U.S. between 1945 and 1965, are at increased risk of having hepatitis C. If you are part of this group, you should be screened for hepatitis C even in the absence of risk factors listed above. The U.S. Preventive Services Task Force expanded the one-time screening population for hepatitis C to adults from the ages of 18 to 79, but this recommendation has not been finalized. You can get hepatitis D from being passed from mother to child during childbirth, having contact with infected body fluids or blood. You can only get hepatitis D if you have hepatitis B. Hepatitis D is not common in the U.S. You can get hepatitis C by eating or drinking food or water contaminated with the virus, the fecal-oral route. You can also be infected from undercooked foods like pork, venison, or shellfish. Hepatitis C is uncommon in the U.S. but can occur after travel to a country where this infection is common. Hepatitis C can be particularly dangerous and even fatal in pregnant women. Who is at risk of getting hepatitis? You are at a higher risk of getting hepatitis if you 1. Share needles to take drugs. 2. Practice unprotected oral and/or anal sex. 3. Have many sex partners. 4. Drink significant amounts of alcohol. 5. Have poor nutrition. 6. Work in a hospital or nursing home. 7. Receive long-term kidney dialysis. 8. Travel to areas with poor sanitation. Diagnosis of hepatitis. The following are required to diagnose hepatitis: physical exam, which may or may not reveal a swollen, enlarged liver. Blood tests to check liver enzymes that are elevated when the liver is damaged or infected, as well as blood tests to check for the presence of any of the 5 viruses causing hepatitis. Ultrasound of the liver to detect any changes. Liver biopsy to confirm suspected inflammation when other tests are inconclusive and to determine the exact degree of liver damage. What are the treatments for viral hepatitis? The treatment for viral hepatitis depends on the type and stage of the infection. Over the last several years, excellent treatments for both hepatitis B and C have become available. More and improved treatments are being evaluated all the time. Your primary care doctor should be able to provide adequate care of your hepatitis. However, if you have severe hepatitis, you may require treatment by a hepatologist or gastroenterologist, specialists in diseases of the liver. Hospitalization is normally unnecessary unless you cannot eat or drink or are vomiting. Hepatitis A usually requires minimal treatment and your liver usually heals within 2 months. Make sure you stay hydrated and well nourished. While a vaccination can prevent you from getting hepatitis A, once you have had it, you cannot be reinfected. Drug therapy. Doctors sometimes recommend drug therapy for people with hepatitis B and C. Antiviral medication for hepatitis B includes adefovir, entecavir, interferon, lamivudine, peginterferon, tolbivudine, and tenofovir. Until recently, the standard treatment for chronic hepatitis C was a course of peginterferon plus ribavirin for people with genotype 2 and 3, and peginterferon plus ribavirin plus a protease inhibitor for people with genotype 1. These treatments had been shown to be effective in from 50% to 80% of those infected with hepatitis C, but the side effects were very difficult for people to tolerate. Treatment now centers on direct-acting antiviral drugs, DAAs. These medicines are highly effective for most people with hepatitis C and are interferon-free and often ribavirin-free. This means they typically have fewer side effects. The treatments are often simpler, consisting of fewer pills for a shorter amount of time. DAAs are available as either single drugs or combined with other medicines in one pill. Elbasvir-grazoprevir, ledipasvir-sofosbuvir, and sofosbuvir-velpatasvir and are once-daily combination pills. Depending on the type of hepatitis C infection, these can often cure the disease in 8 to 12 weeks. Other treatment options include ombitasvir-paritaprevir-rritonavir plus sofosbuvir, ombitasvir-paritaprevir-rritonavir, or some combinations of decladisvir, peginterferon, ribavirin, or sofosbuvir. Hepatitis in pregnant women. If you are pregnant, your doctor will test you for hepatitis B. If you are infected with the virus, your baby will be given immune globulin shots and a hepatitis vaccination. This will help protect your baby from contracting the virus. In addition, it may be recommended that a mother with active HBV receive treatment with an antiviral medication during the 3rd trimester of pregnancy. Hepatitis E can be fatal to pregnant women during their third trimester, and if the mother has hepatitis B, the baby is likely to contract the disease at birth. Other points to consider: if your hepatitis, either viral or non-viral, is in the acute stage, occurred within the last 6 months, avoid alcoholic beverages, as your body's efforts to process alcohol puts an added strain on an already injured liver. Also, be aware that your sexual partners, especially if you have hepatitis B, are at risk of contracting the disease. Hepatitis C is difficult to pass through sexual contact, unless there is blood-to-blood contact. Most adults recover completely from acute hepatitis A and B within 6 months. It's widely known that viral hepatitis can spread through consuming contaminated food or sharing dirty hypodermic needles. But the liver-destroying disease can also sometimes be spread through sexual contact. How many kinds of viral hepatitis are there? Scientists have identified at least 5 types of viral hepatitis that lead to liver problems. In the US, the main threats are hepatitis A, hepatitis B, and hepatitis C. Sexual contact. Can all types be spread by sexual contact? Hepatitis A spreads via fecal-oral contact, which can occur if there is direct oral anal contact, or contact with fingers or objects that have been in or near the anus of an infected person. If even a microscopic amount of virus-laden feces gets into the mouth, infection potentially can result. Hepatitis B, HBV, is 50 to 100 times easier to transmit sexually than HIV, the virus that causes AIDS. HBV has been found in vaginal secretions, saliva, and semen. Oral sex and especially anal sex, whether it occurs in a heterosexual or homosexual context, are possible ways of transmitting the virus. It is not transmitted by holding hands, hugging, or even dry kissing on the lips. The chance of transmission with deep kissing is unknown, as no infections have been definitively documented after exposure to infected saliva. Yet, since HBV has been found in saliva, the risk of transmission with deep kissing probably exists. The risk increases if one partner wears orthodontic braces or has open cuts or sores in the mouth. The likelihood of becoming infected with HBV grows with the number of sexual partners a person has. Thus, promiscuous individuals are more likely to get HBV. Hepatitis C, HCV, is spread through contact with an infected person's blood, which may be present because of genital sores or cuts or menstruation. HCV has been detected with greater than average frequency among people who have a history of sexual promiscuity. This can be defined as a history of a sexually transmitted disease, sex with a prostitute, more than 5 sexual partners per year, or a combination of these. A person who is in a long-term monogamous relationship with an HCV-infected person rarely contracts this virus. Only approximately 2% of sexual partners of HCV-infected people also test positive for HCV. However, it is important to note that this statistic is based on indirect evidence only. Therefore, whether these people became infected through a sexual act or by another route is unclear. For example, people in long-standing relationships generally care for one another in times of illness or injury. During such times, HCV may be transmitted to the spouse or partner, because the couple may not be as cautious about avoiding contact with blood. Are men and women equally at risk of getting and spreading hepatitis through sex? The risk is determined by a person's behavior, not their gender, although some studies have shown that it is easier for a man to transmit HCV to a woman than vice versa. Men who have sex with men are 10 to 15 times more likely than the general population to be infected with hepatitis B. How can I make sure my partner is free of hepatitis before we have sex? There is no surefire symptom or sign to indicate that someone has hepatitis. Some infected people look perfectly healthy even in advanced stages of illness. Experts recommend talking openly with sex partners about the risk of hepatitis and other sexually transmitted infections. Of course, if you notice that someone has yellowing of the skin or eyes, a condition known as jaundice, consider that a red flag. Other symptoms. Other symptoms of hepatitis include fever, fatigue, loss of appetite, nausea, vomiting, joint or abdominal pain, and clay-colored bowel movements. Blood tests are available to help determine if someone has hepatitis that could spread through sex. Are some sex acts especially likely to transmit hepatitis? Any sexual activity that might cause abrasions, cuts, or other trauma is especially risky. Anal sex is thought to be more risky than vaginal sex. And both forms of sex are more risky than oral sex. Oral anal contact is also risky. To minimize the risk of viral transmission, experts say that any sexually active person not in a mutually monogamous relationship should take precautions. They include placing a barrier, such as a condom, dental dam, female condom, and finger cots between you and another person's body fluids and blood, in addition to getting vaccinated against hepatitis A and B. There is no vaccine for hepatitis C. Is it possible to catch hepatitis from kissing? Catching hepatitis by kissing an infected person is unlikely. Although deep kissing that involves the exchange of large amounts of saliva might result in HPV, especially if there are cuts or abrasions in the mouth of the infected person. Can vibrators and sex toys spread hepatitis? That's possible, because the hepatitis B virus can survive outside the body for a week or more. Immersing the vibrator in boiling water may reduce the risk. But the safest advice is to avoid the use of these products until your sexual partner is vaccinated. How effective are condoms at stopping sexual transmission of hepatitis? Latex condoms are believed to be at least 99% effective. Unless you're in a mutually monogamous relationship, it's best to use a condom in every sexual encounter. Some experts recommend sticking with a plain condom. Flavored or scented condoms may be more likely to fail. Don't use an oil-based lubricant, as it can degrade latex. Follow safety precautions when traveling. If you're traveling to parts of the world where hepatitis A outbreaks occur, take these steps to prevent infection. Peel and wash all fresh fruits and vegetables yourself. Don't eat raw or undercooked meat and fish. Drink bottled water and use it when brushing your teeth. Avoid all beverages of unknown purity, with or without ice. If bottled water isn't available, boil tap water before drinking it. Practice good hygiene. Thoroughly wash your hands often, especially after using the toilet or changing a diaper and before preparing food or eating. Tips to prevent hepatitis: there are vaccines that can help protect against many hepatitis viruses. Minimizing your risk of exposure to substances containing these viruses can also be an important preventive measure. Vaccines for hepatitis: a vaccine for hepatitis A is available and can help prevent the contraction of HIV. The hepatitis A vaccine is a series of 2 doses, and most children begin vaccination at age 12 to 23 months. This is also available for adults and can also include the hepatitis B vaccine. The CDC recommends hepatitis B vaccinations for all newborns. Doctors typically administer the series of 3 vaccines over the first 6 months of childhood. The CDC also recommends the vaccine for all healthcare and medical personnel. Vaccination against hepatitis B can also prevent hepatitis D. There are currently no vaccines for hepatitis C or E. Reducing exposure: hepatitis viruses can transmit from person to person through contact with bodily fluids, water, and foods containing infectious agents. Minimizing your risk of contact with these substances can help to prevent contracting hepatitis viruses. Practicing effective hygiene is one way to avoid contracting hepatitis A and D. The viruses that cause these conditions can be present in water. If you're traveling to a country where there is a high prevalence of hepatitis, you should avoid local water, ice, raw or undercooked shellfish and oysters, raw fruit and vegetables. The hepatitis B, C, and D viruses can transmit through contact with bodily fluids containing these infectious agents. You can reduce your risk of coming into contact with fluids containing these viruses by not sharing needles, not sharing razors, not using someone else's toothbrush, not touching spilled blood. Hepatitis B and C can carry through sexual intercourse and sexual contact. Using barrier methods, such as condoms and dental dams, during sexual activity can help decrease the risk of infection. Complications of hepatitis: chronic hepatitis B or C can lead to more severe health problems. Because the virus affects the liver, people with chronic hepatitis B or C are at risk of chronic liver disease, cirrhosis, liver cancer. When your liver stops functioning normally, liver failure can occur. Complications of liver failure include Bleeding disorders, a buildup of fluid in your abdomen, known as ascites. Increased blood pressure in portal veins that enter your liver, known as portal hypertension, kidney failure. Hepatic encephalopathy, which can involve fatigue, memory loss, and diminished mental abilities. Hepatocellular carcinoma, which is a form of liver cancer, death. People with chronic hepatitis B and C should avoid alcohol as it can accelerate liver disease and failure. Certain supplements and medications can also affect liver function. Hepatitis is a type of infection that can seriously damage your liver. And if you're pregnant, you can pass it on to your newborn. You can have one of the 3 most common types of hepatitis viruses, A, B, and C, and not know it. Usually, it won't hurt your unborn baby or affect your pregnancy. If your doctor knows you have it, or might have it, they can help you manage it during your pregnancy to lower the chances of any long-term liver disease for you and your baby.